Hello, Dr. Veneers here at Steinway Family Dental Center. We get a lot of questions about dental veneers, and today we're going to answer some of the most common questions that we get. The first question we have is, what are veneers? So veneers are basically laminates, little tips that they put in the front of the teeth. Usually it's placed on the teeth that are showing. So if you smile and you see the teeth, those are the teeth that would get veneers. It's a little white porcelain tips that will be attached to your teeth and will look cosmetically more pleasing. The next question we have is, when would the dentist recommend using veneers? Well, usually it is a cosmetic option, so if a patient does not like the smile that they have and they would like to improve it, that is when the dentist would recommend veneers. It's also used in cases when there is some kind of a defect in the enamel of the teeth, and that will improve the looks. The next question we got is, what is the difference between dental veneer and dental crown? The difference is that the crown is circumferential. It covers the entire tooth, but the veneer is only covering the front of the tooth. So it's only whatever is showing, that is covered by the veneer. So it just sits in front of your tooth and looks better. The crown is actually requires more drilling, and it is circumferential and it holds to the tooth better because there's more surface area that is attached. The next question we have is, what is the process of making veneers? Well, there are two types of veneers. They're direct and indirect. Direct meaning that it's done right here in the office by your dentist, and indirect meaning that the dentist will prepare the teeth and will temporize it with the temporary veneers, but the permanent veneers are done in the laboratory environment. Those are usually more cosmetically pleasing, and you would get them much better looking. The next question is, will veneers and the cement match my own tooth color? The answer is they could, or they can improve it and look better than your teeth. So it depends on what you are looking for in it. They can either match your teeth, or they can improve the looks of your teeth. The next question is, what is the difference between porcelain and composite veneers? Well, of course, porcelain veneers are much more aesthetically pleasing, and they will last longer, they work harder than composite veneers. Composite veneers are more like a temporary solution while you're waiting for your porcelain veneers to be made. The next question is, what should I do to care for my porcelain veneers? Well, number one, your dentist will make sure that your bite is not destroying your veneers. And in that sense, you may have to wear a night guard at night so you don't destroy them at night if you are Bruxo. Because if you're Bruxo, you may not be a good candidate for veneers. Maybe crowns would be a better solution. That's one thing. The next thing that you should do, of course, you should brush and floss, and you should see hygienists regularly. Next question is, how much the veneers cost? Well, it depends on how many veneers you would need. So I would recommend that you come and see a dentist for that, because the price for the veneers usually is about the same as for the crown. The next question we have is, are there financial options to pay for the veneers? And yes, we have different flexible payment options for you, and you may qualify for the payment over a period of time for them. So you get your veneers, but your payment won't have to be made until a certain period of time passes. The next question we have, does insurance cover the cost of the veneers? Most insurance companies will have some kind of partial coverage, but if it is strictly cosmetic treatment, a lot of them have a rider that they don't cover cosmetic treatments. So if you're counting on the insurance covering the whole thing and you're paying nothing, that will not happen. So yes, you would have to have some kind of expense on getting your veneers done. Next question is, how can I schedule my dental veneer appointment? Well, you can get us online of alldentalneeds.com and request an appointment, or you can just call us at 718-728-3314 and ask for a consultation for veneers with either me or my other doctor, Dr. O'Connors, and we'll get you in, we'll explain all your options, we'll see what you can and cannot do, and explain all of it thoroughly, and then you can make your informed decision. Thank you. That's all the questions we have. So if you want more detailed approach to it, then give us a call at 718-728-3314 and schedule a consultation personally with either me or my associate, and we will help you to decide on your veneers.